And now to our big story.
Nigeria loses billions of naira every year to illnesses and deaths caused by dirty water and poor sanitation. Several reports have shown that too many Nigerians do not have access to safe drinking water and engage in open defecation because they lack modest toilets. In our big story tonight, AIT's Salamatu Ibrahim takes a look at what experts refer to as the silent crisis, its effect on the country's economy on the one hand, and the increasing health risk on the other hand.
Until recently, the Kuizi community in Kuje Area Council of the Federal Capital Territory had just one pit toilet. It served about 50 households. Most of the residents were compelled to engage in open defecation. But after many years of living like this, the community members are now grateful for the intervention of a non-governmental organization. The NGO had engaged members in a 2-week drill on the dangers of open defecation and encouraged them to construct more pit toilets through communal cooperation.
We are expecting that every member of the community must have their own toilets.
That suspicion and difficulty to believe that actually you are serious and you would want to come and help them. The other is where you have to convince the community leaders that actually you are here to support them, not necessarily to help them.
Today they have 30 toilets and more are being built.
Before we have been shit anyhow, but now we start shitting anyhow. And we do our toilet. Now we have many toilets now we are using.
And really we have seen the changes and we have seen our environment very clean. And really before, when we have been fetching that dating water, we be taking what that bring us some of the cholera and diseases.
Residents of the Kuizi community are lucky. Sanitation in most slums like Kuruduma village is much worse. Francis and his family live here. It is a slum located within the highbrow area of Asokoro, also in Abuja. The village-turned slum lacks basic social amenities, including potable water. Most households here are without toilets. Open defecation is a common practice.
1, the children living here, they are not healthy. 2, the adults, they don't feel nice. 3, the women expose their parts to other sections of germs.
We have cholera and other diseases that can come through someone that go outside and isn't safe.
This is a reflection of what most communities in Nigeria are facing. No water, no toilets, leaving them with the option of open defecation.
If you hear about cases of cholera, particularly in the northern part of the country, almost every other month we have cases of cholera reported in one community or the other. So they are there. Maybe some areas they are less than others, but they are still with us. I mean, in the 21st century, honestly, we shouldn't be talking about cholera.
Only recently, an international organization released a report showing that Nigeria is off track in meeting the Millennium Development Goals on sanitation by 2015. What is worse is that 130,000 children under the age of 5 die from preventable diseases every year.
We are losing our children to this illnesses that are caused by waterborne diseases, polio, diarrhea, worms, and we're losing about 530 children every day to this illness. And of course, if we combine that with the figure for adults, we are losing about 1,000 persons every day.
For WaterAid, this is a silent crisis capable of consuming the country if urgent actions are not taken. The agency is also concerned that the culture of sanitation and simple hand wash has declined since 1990. More Nigerians do not have water, and many more are becoming ill.
The crisis that we talk about is not just for the family. It's a national crisis because it undermines our country's economy. Okay, Nigeria, as in most other countries I've found that, loses about 5% of our GDP to the fact that we do not have toilets and bathrooms in our homes, in our public places, and all around us, because our children are dying, our women are not working, our men are spending the money they earn to take care of their children that are in hospital and to maintain their wives that cannot work or be productive.
Water and sanitation is very important, and the crisis about sanitation, especially in our country, is one that we can no longer sit down and watch it, but we have to be up and about to ensure that we carry out sufficient advocacy.
Perhaps if the Nigerian government spends a little more on providing adequate water and improving sanitary practice, the people of Kuizi community, where open defecation may just be a thing of the past soon, and the people of Kuruduma could be guaranteed healthier and safer living, and the country saved from extreme poverty. Salamut Ibrahim, AIT News, Abuja.
The problem of water supply will soon be a thing of the past for the people of Kuruduma village in Abuja, the Nigerian capital, as a non-governmental organization has promised to provide 5 boreholes to serve them. President of the African Children Talent Discovery Foundation, Noah Dalaji, says the gesture is in response to the report he watched on AIT that the people did not have potable water and toilets. He also promised to ensure that the community gets free medical attention and education. AIT's Salamatu Ibrahim has more.
The plight of the people of Kuruduma village was highlighted when AIT visited the village to assess their level of sanitation on November 19, when the world celebrated Toilet Day. It was discovered that the people did not have enough toilets and adequate supply of water.
This community, since I came, I don't know if it is a tradition. Wherever house you go or wherever you rent a house, there's something like toilet there.
Because we don't have any adequate water that we can able to maintain all these toilets that others are people that have the toilet.
These revelations attracted the attention of a non-governmental organization, and the people have been promised water, electricity, free medical care and education.
So because of that, I come with a contractor that is going to, from next week, start digging borehole for you here to get clean water to drink. Because I believe water is one of the most important things.
The village head expressed his appreciation for the gesture. The non-governmental organization went straight to business as children in the village were immediately brought together and taught simple arithmetic. But the free medical help promised was to come another day, soon. Salamut Ibrahim, AIT News, Abuja.